Okay, I thought I'd make another video explaining joint mobs, I guess. I don't know. Concave on convex equals same. Convex on concave equals opposite. When using joint mobilizations, you'll need those locked in. It's pretty much the most important thing. Again, so same equals concave, opposite equals convex if we just look at it like that, because the second part doesn't really matter, you know, because it's always going to be the other one. So if you have concave here, obviously it's going to be convex. So concave equals same, convex equals opposite. Okay, moving on. I'll send a picture of a more in-depth version of this, but anyways, hip is convex, tibiofemoral concave, at least up here. The patella is concave. It looks convex, but if you look in the slides and everything, it is a concave joint to fix things. I'll explain that a bit more later. And the talocrural, so down here, is convex. I forgot an X there. I'm tired. So to fix any movement, use answer from earlier accordingly. So we're going to use these answers to fix a direction that we're limited in. So we're going to use the hip here for an example. We know it's a convex. We know convex means opposite, right? So what motion is limited? We said flexion, and then we're going to say flexion is forwards because you're moving your hip forwards to do flexion. I hope that makes sense. So then we're going to go backwards a little bit, but we know we're trying to increase flexion, which is forwards, and we're going to use a convex joint to be pushed. So since it's opposite, if we're going to push opposite of forwards, which is backwards, we fix flexion. So again, if it's a convex joint and it's opposite, if we have a limited motion and we want to fix it, we want to push in the direction opposite of the affected motion. So just to back it up, hip, convex, opposite, whatever, push backwards. What is backwards in the hip? Posterior. When we go over here, AC, posterior glide of the femur, flexion, boom. So you can just do that for everything. Yeah, I can explain it more if I need to, I guess. Okay, another really quick run through this. Your whole body pretty much follows the same rule, repeating back and forth. There's obviously a couple exceptions, which I guess you'll have to know, but anyways, scapula is concave, GH convex. Anything with your humerus, so either your radius or your ulna, are both going to be concave, so there's two of them over there. And then convex, or proximal, radial ulnar, convex, proximal, distal is going to be concave, radial ulnar, sorry, convex in your wrist, and then everything, you know, here up is all concave. So then we're going to go back to the hip, so concave, convex, concave, convex, concave, convex. Now we're going to go here, this joint, your sacroiliac, maybe, that's concave, but we don't need to worry about that, so we're just going to start at convex, convex, concave. This one's a bit weird because it's concave again, but since we had two up here, you can justify it, maybe. I can. And then we're going to go back to convex, and then it does something funny and goes convex for the rest of the shin. So proximal, tibiofibular, distal, tibiofibular, as well as the talocrural joint. Those are all convex. Okay, so since we've talked about concave and convex and how to fix joints, let's talk about what joints can do. Let's talk about the hip. Hip can do flexion, extension, adduction, abduction, medial rotation, lateral rotation. We're going to put these three in a group together, and we're going to put these three in a group together. Why? Because flexion and adduction usually happen together, and extension and abduction usually happen together, and then I just think that medial rotation kind of fits with these guys, and lateral rotation fits with these guys. So fuck you if you think otherwise. Let's learn this shit. Flexion, picking up the hip, 120. Extension, 30. Honestly, doing these motions and just saying them out loud is probably the best way to get it. But if you need the visuals, here they are. Flexion, 120. Extension, 30. Adduction, 30. Medial rotation, 35. Abduction, 45. External rotation, or lateral rotation, 45. So adduction and medial rotation are very alike, and abduction and lateral rotation are very alike. Yeah, just look at it a lot, say it out loud. Hopefully that helps you. The next part is the capsular pattern. We're going to use this phrase familial, flexion, abduction, medial rotation, over, extension, adduction, lateral rotation. What this means is these are going to go first, these are going to go last if you're having complications with your hip. Like, this is the order it's usually going to follow. You're probably going to lose flexion first, then abduction, then medial rotation, then extension, then adduction, then lateral rotation. Again, hopefully that helps. Resting position. It's the couch position. It's how you sit on a couch like a lazy boy. Think about all sprawled out. 30 degrees abduction, 30 degrees flexion, slight lateral rotation. Because you know when you're super, involved in that show, and then your leg finally relaxes and it just kind of like flops to the side. So that's what this guy's doing. And then closed pack position. Think about like an ice skater. I don't know, someone who like does this. So full extension, full abduction, medial rotation. I don't even think I can do that motion, so I'm probably safe. But take a screenshot, say these out loud. Familial, couch, figure, or ice skater, sorry. All right, here I am again. Let's do it. Knee flexion, 135, extension 0 to 10, internal rotation 10, external rotation 15. Why? Flexion, biggest action of the knee, obviously. So biggest number, 135, kind of close to the hip, Hip was 120, knee 135, pretty alike. Extension, we can't extend the knee that much because your leg just goes straight, obviously. So maybe if you're a bit hypermobile, 10 degrees, but most of us, 0, maybe somewhere in between, I don't know, 0 to 10. Internal rotation, you can internally rotate way less than you can externally rotate, because when we do full extension, we get a little bit of external rotation for the screw home mechanism to lock. So just remember, the bigger one's going to be external rotation, and then internal rotation and extension are quite alike. So those are the motions. Flexion, 135, extension, 0 to 10, internal rotation, 10 degrees, external rotation, 15 degrees. Capsular pattern. For capsular patterns, the bigger movement is probably going to go first. So you're first going to lose flexion, and then you would lose extension. So flexion over extension. Let's talk about resting position. For your tibiofemoral joint, it's going to be 25 degrees. So kind of just like the same as being on that couch. Think about it. You're just sitting there. Your knee's pretty happy at 25 degrees flexed. Your patella, on the other hand, is going to be fully happy when you're fully extended. So these two guys kind of work, this is his antagonist. Okay, they hate each other or something like that. It's kind of funny because if we go to the closed pack position, tibiofemoral, full external rotation and extension. So the opposite of this guy's happiness, or the tibiofemoral, when he's bent, or when I say he's just talking about the guy, I guess, but tibiofemoral, when he's bent, happy. Fully extended and a little bit external rotation, angry. Now, patella, fully extended, happy. Patella flexed, angry. So you kind of go back and forth. Anyways, ankle kind of sucks, so let's try to get through this. Plantar flexion, 50 degrees. Dorsiflexion, 20 degrees. Inversion, 35 degrees. Eversion, 15 degrees. That seems really wrong. I think it's right though, because I'm doing it with my feet and it feels right. Just that number seems huge. All right, whatever. Plantar flexion, 50, dorsiflexion. I should do it with my hand. This is your foot. This is your foot in plantar. This is your foot in dorsi. So plantar flexion's 50. Dorsiflexion, 20. I'll be able to get a bit more. Inversion, so you're going 35. Eversion, 15. All right. Plantar flexion, or sorry, capsular pattern. We're going to lose the bigger one first. What's the bigger one? Plantar flexion, because we know that from earlier, because we have more plantar than dorsi. So we're going to lose that first, and then dorsiflexion. What else does that mean? Resting position. If plantar flexion is bigger, we're probably sitting in that motion more. So it's happier plantar flex, just a little bit. And then if it's happy here, what's it going to be angry? Probably way up here. So full dorsiflexion. So this guy's doing like the Michael Jackson thing, but he hurt himself doing full dorsiflexion because of that closed pack position. So watch out.